Good evening, everyone. So, dear friends, this is the question asked in the group. The 16 years girl with a balanced body and height and hair. Okay, shall we write down step by step? So, the patient name is not given. This is the girl, age 16 years. She has stopped the wheat. So maybe allergic to the wheat. Maybe someone has advised. So she has stopped the wheat. I will arrange tomorrow. And lost 10 kg weight. And since 1.5 months back, 3 times cold attack. So she is the girl and cold has attacked. Cold attack. Since 1.5 months back, 3 times cold attack at 2 p.m. And after the cold attack, she is getting full body itching. Full body itching. Last attack was 1 day before Holi and recently 2 days back. And the treatment has been given on the mega meridian. So Li4, stomach 36, spleen 6, etc. And with this treatment, she become all right in 20 minutes. In 20 minutes, she became okay. And the matradana has been put. But happened till now 3 times. Please guide why it happened and what to do. Who has asked this question? Name is not given. Who has asked? Okay, no problem. So can you hear me properly? We will see what is the reason. So what are the main points in this question? She is the teenager girl, very young girl. But she is having allergy with the wheat. And nowadays, not only this girl, the lots of person having allergy with the wheat because the wheat we are eating. This is not the wheat we were eating earlier. The wheat we are eating right now. This is the dwarf wheat. Dwarf wheat. The meaning of dwarf. Earlier wheat was like that. But nowadays wheat is like that. The stem has reduced. So this is the genetic mutation in the wheat. So that wheat can be grow very faster. And this wheat having gluten. And this gluten is giving allergy to many person. So if someone is suffering with the allergy, like this girl is suffering, with the skin allergy or urticaria, so the doctor someone has stopped the wheat. Okay, that is right. But she has lost 10 kg body weight. It means whatever she is eating, something wrong. Because she has lost 10 kg body weight. Now, the attack of the cold giving full body itching. Full body itching. Why this cold is giving the full body itching? So the main points. Number one, so this girl is suffering with the urticaria. Urticaria. The meaning of urticaria, the full body itching. So the question is that please guide why it happened and what to do. Okay, so let's discuss about this. So number one thing, who is responsible for disease? Who is responsible for disease? Like virus is responsible for disease or bacteria is responsible for disease? Who is responsible for disease? As per the acupuncture, the many pathogenic factors are responsible for disease. Many pathogenic factors. The pathogenic factors who are responsible for disease, number one is wind, number two, cold, number three, heat. Tell me what else? Tell me what else? Tell me pathogenic factor, the responsible for disease. Damp, very good. What else? Damp or humidity can be kept under one. What else? So damp, humidity and phlegm can be considered one. The dryness, the dryness, the dryness can be mixed with others. So as per the acupuncture, we have to find out who is responsible for disease. So wind, cold, summer heat, dampness, dryness, and we can tell what else? We can tell fire, or we can tell heat can be. Heat can be two types of categories. So the wind may be responsible for disease, the cold may be responsible for disease, like you are going in the air. And someone is having the attack of the air, and he may suffer with the wind attack. As per the acupuncture, the meaning of wind is virus. As per the acupuncture, the meaning of bind is virus, including COVID virus. All the virus are bind. So when we are talking about the bind attack, it means we are talking about the all the pathogenic factors like virus. So there are mainly 6 pathogenic factors in our body: bind, cold, dryness, dampness, and this fire. These are the 6 main factors. These are the called pathogenic factor. So now all the disease are happening because of these 6 pathogenic factors. Now this girl, the 16 years age of girl, when she is under the attack of cold, she get urticaria, means itching all around. So what is itching? So the cold attack giving the urticaria, it means this female is having excessive dampness, means over this pathogenic factor, because dampness means undigested food. Dampness means humidity, collection of food debris, and the female is unable to throw out the undigested food from the body. So this undigested food or humidity has been collected in the body. This is already in the body. So when she is going in the cold air, the cold air is attacking and body already having dampness, and if body already having heat constitution or damp heat, so any types of external attack may create the itching all around. Okay, let's discuss about the damp heat. So in these 6 pathogenic factors, this is the dampness and this is the heat. So when anyone having the dampness plus heat in the body, then what will happen? The dampness will give the itching and heat will give red spots. So it is called urticaria. If you have seen the patient of urticaria, I will show you. I will show you the case of urticaria. Maybe you are knowing that. So look at this image. Now see, do you feel this types of urticaria is not having heat? You can see the image and you will tell definitely this is because of the heat. You can see any patient who is suffering with the urticaria. It's clearly given, it's clearly visible that this is red eruptions. These are the red eruptions, and these red eruptions having heat as well as humidity or dampness. You can see here. Now you are telling that it may be because of the dryness. You are telling that it may be because of the dryness. So we'll discuss. Because the dryness is giving the black color. Dryness is giving the color little blackish. And heat is opposite. Heat is giving the red color. So this is the urticaria. Okay, let's discuss what is exactly damp heat. Then we'll discuss your confusion also. Number one. This is the, suppose this is the mud. Sorry. This is the mud. This is the little bait mud. Now, if you are giving continuously heat, and within few days, this mud will be very hard, like a stone. So this mud has become the stone because this mud is already having mud. Mud means earth element or dampness, and this mud also has got the sun exposure or heat. It means if there is a dampness plus heat, it will make the mud harder. So suppose this is the gallbladder and someone is having coldness and someone is having dampness as well as the heat in the gallbladder, then what will happen? Tell me, what will happen? If someone is having dampness and too much heat in the gallbladder, then what will happen? It will create gallstone. So what is gallstone? There are two types of gallstone can be categorized here. One is the gallstone who is silent, and another gallstone who is painful. Who is painful? Because inside the gallbladder there is a stone who is having humidity as well as heat. and heat will create the inflammation. So the person suffering with a silent gallstone, then nobody is doing anything. But the person is suffering with a painful gallstone, then what is the acupuncture diagnosis? As per the acupuncture, it is the humid heat in gallbladder. Now suppose this is the kidney. These are the two kidneys, the right kidney and the left kidney. The kidney is having dampness and heat. So the kidney is having dampness plus heat. Then what will happen? Tell me, what will happen? If kidney is having dampness as well as the heat, then what will happen? So it will create the kidney stone. And this kidney stone will irritate the wall and create pain. So as per the acupuncture, what is kidney stone? The meaning of kidney stone, that humid heat in the urinary bladder or kidney. Or we can tell humid heat means damp heat or humid heat is the same thing. So the humid heat in the kidney, so humid heat or damp heat in the kidney will create the stone. So now understand one thing, if dampness is there, it will create the heaviness, because the characteristic of dampness is earth. Earth means heavy. So the dampness is, where is the dampness? There will be heaviness. And heat is there, then it will create the infection. So the damp heat means heaviness plus infection. Now suppose if humid heat in the kidney and humid heat in the urinary bladder. So the humid heat in the kidney will create the kidney stone, and humid heat in the urinary bladder may create the bladder stone as well as, because this is the infection, it will create UTI, means urinary tract infection. Urinary tract infection or UTI. The infection in the urinary tract. Now, this is the large intestine. This is the large intestine. Now, if humid heat in the large intestine, tell me what will happen? Humid heat in the large intestine. What will happen? Tell me. The humid heat in the large intestine will create ulcerative colitis. Because heat will create, the humid heat is always creating the infection. So as per the acupuncture, what is ulcerative colitis? Ulcerative colitis is humid heat in large intestine. So this is the ulcerative colitis. Now, this is the stomach. If in the stomach there is a dampness and heat, so this is the stomach. Tell me what will happen? What will happen? If in the stomach there is a right, it will create, because the dampness and heat is creating very severe problem, not a normal problem like acidity. Acidity is a very normal problem. It will create the stomach ulcer. Stomach ulcer. So as per the acupuncture, what is stomach ulcer? The stomach ulcer means humid heat in stomach, and the person will be having vomiting, nausea, hiccups, and abdominal pain. So the humid heat in the stomach. In this way, now, if there is a humid heat in the heart, humid heat in heart, tell me what will happen? If there is a humid heat in the heart, what will happen? There is a humidity and the heat. What will happen? As per the acupuncture, dampness is like a cloud. So this is the sky. This is the sky. And here is cloud. They are the cloud. The cloud means dampness. So the person having dampness in the body, always in the doubts, and he can't believe to anyone. The wife cannot believe on the husband, and husband cannot believe on the wife, because heart is the place of love. And there is a flame in the heart. Then in place of love, the heart will be full of doubt, and the heat will create too much hyper heart, so the person will suffer with the manic behavior, like ghost is inside the heart. Person is having very manic behavior, emotional ups and downs, sometimes very happy, sometimes joyful, and sometimes severely depressed. This is because of the humid heat in the heart. So the person suffering with the mania, first you clear the unwanted flame from the heart. So this will create the mania. Suppose if there is a humid heat in spleen, what will happen? Always remember, the heat is always creating foul smell. If there is a foul smell in the urine means heat is more. There is a foul smell in the stool means heat is more in the large intestine, whatever. And spleen is connected with the digestion. So the humid heat in the spleen will create, tell me what? The spleen will create foul smell. The spleen will create foul smell, diarrhea. One day what happened? Or we can tell it food poisoning. Even we can tell food poisoning. One day, one patient has taken the food outside in the hotel, and the hotel persons has given some food like cooked 2 3 days ago, and they served the means wrong food, and suddenly he got the food poisoning and continuously diarrhea, fever, and very foul smell diarrhea. So that is the food poisoning. What is food poisoning? So food poisoning means humid heat in humid heat affecting the spleen. Spleen. So in this way. Now you told me the pericardium is very deeply connected with the heart. If there is a humid heat in the pericardium, then we will tell blockage. So this is the blockage. But if it is in the heart, then something, mania, behavioral ups and down. But when it is in the pericardium, it will create the blockages. Now, in the old person, if this is the prostate gland, in the prostate, there is a humidity and heat. Tell me what will happen. The humidity is plus plus and the heat is plus plus in the prostate. What will happen? It will create the enlargement of the prostate. In any disease, in any disease, if fall smell coming, so fall smell is the result of heat. Remember always. So what is if the in the full body, in the full body, dampness plus heat is there, then it will create urticaria. Urticaria. So the urticaria, the 16 years girl having the urticaria, and when she is under the cold exposure, because the cold is affecting the dampness. So when she is under the cold exposure, she is getting urticaria, means the girl is walking in the cold air and she is getting red spots. So that is the humid heat in full body. In the full body, the dampness and the heat. So it will create the urticaria. So what is the treatment for this girl? Okay, I want to ask the person who has asked this question, whether right now listening this lecture or not. The person who has asked this question. listening this lecture or not? I don't know who has asked the question, but this question in the group. No? Then we'll ask for the recording, which I will not provide. No, it's not, because if the person is there, then I will tell the protocol. Nah? Otherwise, what is the need of protocol? No? Okay. So let's discuss. We will discuss the protocol. Okay. I don't know the person is here or not. Okay. So when we want to treat the urticaria happening in the full body, what is the treatment? The treatment is this. See, fall smell anywhere, that is because of heat. If heat is not there, then fall smell will not be there. Remember one thing. So now we are coming back to the urticaria. And the person who has asked this question, she has given Li4, stomach 36, spleen 6, and in the 20 minutes she became okay. Why? How these points worked? Okay. So I will tell you my protocol for the urticaria. My aim to drain out heat plus dampness. This is my aim. If I will able to expel out heat and dampness, then we will able to treat the urticaria. How can we drain the heat? So the Li4 is really very wonderful point, because Li4 sedation, definitely we will do the sedation of all points, because this is the excessive condition, the excessive dampness and the excessive heat. So definitely we will sedate the Li4, and not only Li4, we will sedate all the points. One more point is Li11 is very wonderful point to expel the heat from body and intestine, because the 16-year girl, she has stopped the wheat and lost the 10 kg weight. So we have to reduce the heat, and also we have to work on the large intestine. So the Li4 and Li11 is always good for all types of urticaria. So these are good options. Number 3. Now when someone is having the attack of something and itching, so this is the excessive condition. So we have to reduce the yang. How to reduce the yang? The governing vessel 14 is the meeting point of all the yang. Meeting point of all yang. So just a sedation on single point on the governing vessel 14, the single point at a time reduce all the yang energy, because the girl having excessive yang in the form of damp heat. So with the help of governing vessel 14, we will able to reduce all the yang force. Now, let's think about the dampness. So definitely we can reduce the dampness with the stomach 36. We can reduce the dampness. What points he has taken? 1 minute. Yeah, stomach 36, spleen 6, right? So we can reduce the dampness. Dampness means kapha, phlegm, humidity. So we can also take the spleen 6. This is for the purpose of dampness. But with that, we will take, on the one side, we have taken the point to reduce the heat. On the other side, we have taken the point to reduce the dampness. Now, we will take one more point to reduce the bind attack. So for the bind, we will take the point of gallbladder, that is gallbladder 34. Sedation is very good. So the gallbladder 34 sedation is very good for this types of patient. So finally, our protocol will be Li4, Li11, governing vessel 14. This is to reduce the heat. Then stomach 36, spleen 6 to reduce the dampness. Then gallbladder 34. Even we can take some more point like gallbladder 31, but one point is enough because the gallbladder 34 is very good point because it is also influential point. So we'll take this point and if we see the Chinese acupuncture, if we see in the Chinese acupuncture text, so the same protocol has been given. The same protocol has been used in the Chinese acupuncture books. They have given, because this is the itching, urticaria. So we have to reduce the dampness. We have to reduce the heat. So with the help of this protocol, we can reduce both. For the faster relief, we can do bloodletting from ear apex. We can do the bloodletting from ear apex, from the top of the ear. If we do the bloodletting from the ear apex, you will see the results in 30 minutes. And even with the points, our healer has got the result in 20 minutes. So this is the completion of Urticaria protocol. Any question? Moxa is not at all recommended because moxa means, yeah, this is the very good. The stomach 40 is really very wonderful point. Definitely. We can see, we can add few more points as per our own understanding. I'm agree with you. Even we can add spleen 9 and even we can add stomach 40. Definitely we can add it. The REN 9 point is good for water retention. The REN 9 is good if we are working for the water retention, but spleen 9 is really good point. So we can add spleen 9 and as well as stomach 40 sedation. Definitely, these are the good point. See, ultimately, we are working for the dampness and heat. We can add more point. We can add spleen 10, UB 13, then we can add spleen UB 20. But this is the protocol. short and sweet. We can also bleed lung 5. That is also right. You are right. So we can also bleed lung 5 because lung 5 bleeding is very good for skin. Very good for skin. So this will remove the damp heat from all over the body. So we are reducing the yang with the help of governing vessel 40 because this patient is having excessive syndrome. No, 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 no. This protocol cannot be used for gallstone, for kidney stone. This protocol cannot be used for ulcerative colitis. This is the protocol just for urticaria. Urticaria. The gallbladder 34, we are sedating with the purpose of bind because the female is getting the itching when the bind is attacking. No need to add gallbladder 30. In the traditional Chinese medicine, what the person doing, they are taking out the blood from the lung 5 and inserting the blood on the gallbladder 30. That is also one therapy. So this protocol is only and only for urticaria as per the questions because we are moving as per the question. Okay. Any more thing you want to add? Anyone want to add something more? Do you have something in your mind? Tell me if you have something in your mind. But this is the really wonderful protocol for the urticaria. Urticaria is the suddenly, like you are going for walking, you are doing morning walk, and suddenly you are getting red itch, eruptions and itching. Or you have gone somewhere, you are taking the cold water bath, and suddenly you are getting the red eruptions throughout the body. That is urticaria. Yeah, in the Ayurveda we are telling Sita Pitta, Sit Pitta. The last 2 points we have added is spleen 9, sedation and stomach 40 sedation, because spleen 9 reducing the dampness. And stomach 40 is also very good point to reduce the phlegm and dampness. No, no, it means that I'm not telling that you should not go for the morning walk. I am telling you that you have to rectify the humidity and heat. Even after you are not going for the morning walk, but humidity, heat in the body. And if you ask the person who is having urticaria, the urine and stool will be foul smell because heat creating the foul smell. Both thumb, 0 tone, 9 sedate, yes. That is also very good Ayurveda treatment. And also, there is very good treatment in the mega meridian, if you know that, on the wrist. Enough? Okay, so shall we discuss the location of this point? Or all of you know? All of you know? We will discuss the kidney cyst as if you want, but right now we have taken the urticaria because we are discussing on the questions. The questions like you are facing in your family, with your friends, with the patients, we are discussing that. Okay. Okay, so let's discuss the location of these points. Okay. Okay. So we are discussing the location now. So first, the I'm telling Li4 and Li11. So this is the large intestine meridian. These are the joints. The Li4 is just little distal from the upper joint. That is the Li4. So we have to do sedation. And Li11 just over the second joint. This is the Li11. So we have to sedate both the points. Now coming to the middle finger. In the middle finger, this is the stomach meridian. And these are the two joints. If we look at this upper joint, just 1 millimeter down, this is the location of stomach 36. So we have to do sedation. Now we are coming to the middle line. This is the gallbladder meridian. So from this joint, just 1 millimeter down, this is the gallbladder 34. So this is the gallbladder 34. We have to do sedation. So Li4, Li11, stomach 36, gallbladder 34, all points sedation. Now coming to the thumb. So look at the thumb. This is the lower joint, this is the middle joint. So just on the junction of this lower joint, this is the location of gallbladder 14, which is the meeting point of all the yang meridian. So all the yang meridian crossing this point. So the single point sedation will sedate all the yang meridian together at a time. So this is a very good point for fever and for urticaria, both. So this is the gallbladder 14. So we have discussed Li4, Li11, stomach 36, gallbladder 34, and governing vessel 14. Now we will move front side. One more point has been told, that is stomach 40. Stomach 40 is very good point to reduce the phlegm. And we know this is the stomach meridian. And in the stomach meridian, so this is the stomach meridian. These are the two joints. Just middle point, that is the location of stomach 40, but stomach 40 is little inside. So this is the location of stomach 40. Stomach 40. Stomach 40 is very wonderful point for reducing the phlegm. Now we are going to the front side. In the front side, we are having spleen 6 point and spleen 9. So the spleen meridian is coming like that. See. So this is the spleen meridian. So these are the two joints. And Just at this joint, this is the location of spleen 9. It is little down, and upper is spleen 6. This is the spleen 6. Let's look at once again. The spleen 9 is little 1 millimeter down from the joints, and this is the location of spleen 6. So just set it on the point, see the chart and put the point. You have to put the point after seeing the chart. So see the point and press with the acupressure probe. The whichever point is sensitive, do the sedation. So done. So we have to keep the magnet minimum for, like you will see the good results within 30 minutes. But keep the magnets minimum for 4 to 8 hours. 4 to 8 hours. Needles 40 minutes is enough. For the needle 40 minutes is enough, but for the magnets 4 hours to 8 hours is the minimum time. So we are closing the class today. Thank you so much. Now see you on Monday. अब मंडे को मिलेंगे, मंडे को हिंदी में होगा. गुड नाइट.